pain in the testicle, many causes. What would come to your head first?
That's $1 million question.
Okay, we'll make it $1.95. Cut it down.
That's a lot of time. You have pain in the testicle. You find no causes. You find nothing. You got to check for a hernia. You got to check for a varicocele. You got to check also for an infection in the prostate.
What about a twist?
A twist is something that they're not going to come consulting. It usually happens very suddenly. It's in sudden onset of pain in the testicle.
So if you get sudden pain in the testicle, you don't wait to see the doctor the next day. If you have concerns, you should go to the emergency room and they will do a study to see if there's adequate blood supply to the testicle. It's
Correct.
not twisted?
Correct.
You don't wait in that. Is that correct?
That is correct. Because you have only 3 hours to save that testicle.
Not 3 days.
Not 3 days. Most of the time, it happens in the middle of the night. The pain awakens in the middle of the night, the person, and it's most common on the left side.
What would make you think it's less likely a torsion, which is an emergency, to something that's maybe less of concern?
Well, you got to check the urine. Make sure that you don't have any pus in the urine and you have no burning sensation on urination. If you got pus in the urine and burning sensation on the urination, it could be an inflammation of the testicle, which is due to the infection of the prostate or a urinary tract infection. If that is not the case, because you see the kids that they come to the emergency room, they'll check their urine to make sure that they don't have an infection.
But they also do a flow study, don't they?
But they do a flow study. They do a sonogram with a Doppler. And that is going to tell you whether or not the artery is patent or not. If the artery is not patent, then basically you have to take them to the OR immediately, untwist it, and fix the other side also. Because under the proviso that whatever happened to this testicle eventually may happen to the other side.
So basically you make it so it can't happen again?
So you make it that it could not happen again.
So in other words, testicular pain, red flag, you don't sit on it, you speak to someone right away. If you can't get to a doctor right away, go to the ER, have it evaluated, because if it's torsion of the testicle, as you say, you get 3 hours.
Yeah, especially if it's a very young person. If it's anybody that is under the age of 15, I mean, chances are this is not an infection. It is a torsion, a sudden onset of pain. And there is a peculiar, when you look at the kids, they walk funny. They walk with their legs spread apart. Because when you put the legs together, it hurts. Now, when it's a torsion, if you lift the testicle up, the pain gets worse. If it's an infection, you lift the testicles up, the pain gets better. So that's another thing. However, it's not 100%, so you still need the Doppler. If it would be 100%, you don't need the Doppler.
So in other words, pain in the testicle, red flag, don't fool around.
Immediately don't fool around. Because you may